I think that providers have to understand that this is what people want. I am Orlando Morales, and I'm in MelMarie's 300-hour yoga therapy program. I am an entrepreneur, a business owner, and registered nurse, and a stay-at-home dad. I own Willow OBGYN. I also own House of Rhythm Yoga Studio. This is what the consumer, their clients, their patients want from their physicians. They want their physicians to listen. They want their physicians to embrace, a holistic approach, to be open to other modalities or to alternative, whether it's, the use of supplements or the use of meditation, the use of breath work, all these things, or body work, all these things, complement, medicine. It complements the surgery. It complements the medications. It complements, all the health practices that physicians are taught in medical school. It brings everything together. And, as time goes on, as we're learning, especially in the last decade, people are realizing, the medical professional is realizing that these alternative, quote unquote, alternative modalities, that these holistic practices actually work.
So the United States is number one with healthcare allocation for healthcare costs, like how we're spending our money on healthcare. We're number one. But we're number 16 in the world for being the healthiest. Such a problem with that disparity. This is obviously calling us to reflect on, okay, we're spending all this money, but how is this actually paying off on the other side? This is what integrative medicine is about, and I don't like to use the word preventative as much as I like to use the word proactive. And the reason is because in preventative medicine or preventative care, we kind of look at that as our daily checkups, immunizations, and things of that sort. But proactive health is this work of lifestyle, self-awareness, mobility, doing things for maintenance. That's proactive, that's participatory health, and making room at the table for more of those conversations, or that we bring this to every fragmented specialization out there, right? All the different specializations. It doesn't need to have its own table. Maybe it's just that we bring this new texture and layer into academia for providers or for clinical health management, for our management people and healthcare services.
There are certain clinics who are already doing that, certain integrative medicine clinics, or even like obesity medicine clinics, where they are looking for yoga therapists, of course, other lifestyle interventions like exercise physiologists, of course, dietitians, to educate more lifestyle interventions for the patients. My hope is that more and more physicians in the primary care community take the time and effort to educate patients. I think everything all comes to education. If more and more physicians advocate for mindfulness, there's a lot of chronic diseases that can be prevented as well as treated so that the condition doesn't worsen.
I'm Amanda Galan Davila, and I'm an assistant professor at the University of the Incarnate Word School of Osteopathic Medicine. I am also a 200-hour graduate from MelMarie's registered yoga teacher training program, and currently in her 300-hour. We center our education towards human health and disease around the model of mind, body, and spirit. So osteopathic medicine kind of already comes incorporated with this belief that, the body and the mind have that connection to spirit based in the universal understanding that we are autonomous, that there is energy in us. Osteopathic medical philosophies believe that the body is self-healing, and that as a medical community, our job is to support the body's healing. However, I will tell you that because of the nature of medicine in the current time that we're having this interview, many of those beliefs it's very difficult to translate into. We are in the process of trying to establish something a little more organized and formal at the university, really in terms of just having a yoga club, because we don't have that yet. Many students have asked for it. And what they're craving is they want to find peace. That's always the theme. It's like they want rest, they want stillness, they want peace, and they do not know how to achieve it. What's very interesting, while they are having a hard time achieving that peace, they are being delivered curriculum on how to guide their patients towards peaceful treatments, how to find help in the community to support their lifestyles. And we often talk about if we are not able to find that balance, how can we be good providers? Not even just in giving efficacious treatment, but if we don't have balance in our life, how are we showing up to patients who are in need of our services?
I mean, I remember in nursing school, somebody talked about, make sure that you're doing self-care and make sure that you're exercising and eating healthy. And that was it. That was the conversation. What they didn't talk about was, what does it look like when you're constantly putting everybody else in your life and in your work ahead of yourself? What's the cost to you? And just having a frank conversation of saying, these are the things that happen in our nervous system over time. This is what it looks like. Here are the practices that you can put into place. And this is why it's important, not just for you to do it periodically to make sure that you have vacation and that you're using it, but also what are the things that you're doing in a daily life?
I think a lot of physicians might not be really officially trained in mind-body medicine, because in medical school we didn't really learn or talk about mindfulness. I think that's starting to change now, where they're incorporating more of that in medical schools and residency training as well. So I'm hopeful that that's improving. I've known a lot of residency programs having somebody who is specialized in mind-body medicine, like a yoga therapist, come in and chat with them about mindfulness. And then, if more physicians are being educated, the more we become better at educating our patients.
My hope is that my deep dive into mindfulness, I can share with other practitioners. I can hopefully create programs within the education landscape to build it into the curriculum, perhaps build it into and thread it through the education that every individual is going through at the university level, and so on. So, there have been pilot programs with some yoga here and there and things like that, which are great and extremely helpful. But I think mindfulness is something where you can put that hat on at any point in time. You don't need a yoga mat, you don't need a teacher, you don't need whatever, because we can do it from within. So
the way we look at healthcare is determined by our knowledge, and knowledge itself is what expands the paradigms. This is why I'm targeting education, because education is going to help us understand more of a need, look into research, because there's already a lot of efficacy and data out there, but the funding and the need for more research is apparent as more findings are finding exciting things. It just leads to this whole unfolding. The challenge that we're facing today is that healthcare is looking for it, they need it. They don't know who to go to for it, who is actually trained in stress management and addressing non-communicable beyond the biochemical, beyond the very, traditional allopathic perspective. So who's equipped to do this? So they're going, who does this? And looking at where's the education coming from? Where the universities and education's going, we can equip, we can do this, but where are the job opportunities? So we have a struggle on both sides of the fence, and the more awareness we can bring into the provider side, more awareness we bring into the equipping the future yoga therapists or the future mind-body medicine providers, this will eventually, the roads will cross. but we gotta be here before we can get here.
In the medical system, where people they have the opportunity to sit and listen to their patients, where they have the opportunity to offer mindfulness to their clients, where they're prescribing things like breath work and movement and going outside in nature and going for walks. It's a whole program that is completely focused on preventative medicine, becoming aware of the conversation between the mind and the body, teaching people how to listen to the signals that are coming from their body, giving people the tools to be able to understand that. And for nurses, for doctors, for respiratory therapists, anybody that works in the medical profession, having them incorporate mindfulness, not just for their clients, for their patients, but also for themselves, that they're taking time in between clients to breathe and to ventilate, so that any emotions that they may have had in that one particular instant, that they're able to ventilate that and not carry it into the next client.
It's funny because I never thought I would be in this particular world, in the OBGYN world, in the women's health world. I've been with Kelly, we've been married for going on 25 years in January. I've been with her in the very beginning of her journey, like when she was in undergraduate, like learning to be a pre-med, through her medical school for residency. She wanted to be an obstetrician. During her medical school, she delivered, I think, close to 60 or 70 babies during medical school. And so it was really a calling for her. She was in the military. She went to residency over here at Brooke Army Medical Center. And they have a very holistic, hands-on approach. Enjoyed her time with the midwives over there at BAMC. And she had the time to really develop a way to listen to her patients. She would recommend some holistic things, prenatal yoga, prenatal massage, the perineal massage, preparing the birth canal to have these women be able to deliver vaginally as they want. As she's developing these skills and developing these co-modalities to as an adjunct to assist with these births, it became more and more and ingrained in our practice. As we started going down that road, we met people that were pelvic floor professionals and mindfulness professionals. There were studies that were done that would show, how having a more holistic approach towards women's health care produce better outcomes. So when it was time to open up our own practice, which we opened Willow this last November in 2022, it was natural for us to want to include that as part of our practice. Here at Willow, we have, besides, the obstetric care, we have classes for mindfulness. We have yoga, prenatal yoga classes. We have pelvic floor therapy, and we have massage therapy.
So integrative medicine has really grown since 2014. That's really when it became established. And then we saw, I believe it was 2017 or 2018, but Joint Commission started requiring non-pharmacological interventions in hospitals for pain management, which that ends up increasing more need for mind-body-based modalities. We also saw in 2012 and I think 2017 that yoga was the top integrative care intervention utilized. So we know yoga is at the table, and it's really about streamlining the delivery of it and finding ways to educate so we can have reliability among providers. And this is why we're involved with IOIT. We're at those tables to understand what is healthcare looking for, and how can we create professionals to serve in a scope that makes sense for all of the different moving parts in healthcare.
Going into nursing, there's so many people that go into nursing because they want to be helpful. They want to be helping other people. When I started practicing yoga more consistently and really going through the yoga teacher training, what I found was all the pieces of me that had been dulled and how that was taking away from me as a nurse, how that was taking away from me to be an effective nurse. So while I was working at the bedside, I noticed I was able to sit in that stillness and just be with the patient, let them be seen, let them be heard. I would go in and I would guide a patient to breathe while I was working through a procedure with them. If I was inserting an IV, or they were having issues with anxiety, or and it wasn't, they didn't have a medication that was available to them at that time. What were the things that I could do that would help them to self-soothe? Could I put music on for them? Could I put a TV show on for them? Could I sit and read a book to them for a little while? There were just different things that came to light for me that really helped me in terms of being more responsive, being more aware, being more cognitive of, how was I entering the room? Was I entering the room all, crazy and harried and, task focused, or was I walking into the room and making sure that I was connecting with the person, that I was sitting down, that I was talking to them? I became much more aware of soothing their nervous system, and so I sought out more opportunities. I asked more questions. If somebody wasn't able to communicate for themselves, then I was asking their family members, what are the things that we can do that are going to help them soothe? What are the things that make them feel calm and relaxed?
Skill set that's needed, yes, is very physical to work with patients, but the access of knowledge is very cerebral, right? Going into the mind, okay, pulling out, what do I know, integrating, etc. And you're having to do that all day. With that being said, I feel like many of our residents just live in their mind. And so there's a lack of that mind-body connection. When they're talking with someone they're serving, like a patient, are they really listening, or are they already drawing up the treatment plan? Presence, learning to be present for their own wellness and for the service of their patients. There's a lack of mindfulness of, like, for example, am I squatting to lift this with good form? I don't think many people think about that, right?
Whether it's just having somebody on staff at integrative care clinics, whether it is having this on staff for mental health clinics, where it might be certain times or days, or they might do cohorts for the clinic. It could be just the individual yoga therapy clinics, and you go for yoga therapy, to making it accessible in HR departments for employees. It could be one-on-one, but what's so cool about yoga is it's a cost-effective, person-centered service that can be delivered in a wide-scale way. So we can have a lot of people experiencing it at once, but still having their own experience based off of the way the teacher is teaching. So if the teacher says, at your pace, when you're ready, it's invitational language, they give options. It gives people a place to reclaim their choices and have their own experience, even if they're in a room with a bunch of others. So the teacher does make a big impact of whether that happens or not. Instead of waiting for it to be at your clinic, go find someone in your community to work one-on-one with, or seek these things out, try them online. There's a lot of ways. Learn about it yourself, because the more we're self-educated, the more we spend our money in these arenas, the more these systems will catch up, because if all the money and energy is going there, they're going to go, wait, hold on, we want a bite of that, and it starts to move the whole collective system that way, which I believe we're already moving that way, but that's how we continue the momentum.
I feel if we concentrate more on prevention, then we can shift the future of our health in our society. There is definitely a huge understanding that if we can prevent from a condition getting worse to the point where you need multiple medications or procedures, then that saves the healthcare industry tons of money.
Having a system where we're supporting each other to seek things like mental health therapy, where we're seeking out different practices like meditation and yoga, and it's being incorporated as a way not just for them to offer it to their clients, but they're using it for themselves so that they can stay in their profession and stay in their profession as their whole self.
If there are therapies coming out like biotechnology, light therapies, energetic type, resonance fields, like these therapies that are regenerating cells, the state of impact is much more louder when we're in a regulated state and receiving it. Just use an example right now, even with chemotherapy, for example. There are yoga therapists that are working in chemotherapy labs or as a health advocate with a patient receiving chemotherapy. And while the patient receives chemotherapy, the provider is guiding them through yoga nidra. And they're showing a whole different experience. Or even if the patient just listens to yoga nidra while they receive chemotherapy, whether it's pharmacology or biotechnology, the state of the nervous system when receiving treatment does impact patient outcome. And so that's another world where we really have an opportunity. And with insurance right now, I know that a lot of insurance is billing people are making more money in healthcare when patients are getting better and having better outcomes. We do have that system. And so how do we help clinics improve patient outcome? Nervous system. That's our specialty. That's what yoga therapy does. We are healers for the nervous system.